All right, sometimes we'll have patients come in that are on crutches or walking with a cane, and we'll help them adjust them so that they aren't hurting themselves in other areas. So with crutches, you want the top of the crutch to be 3 finger space down from the armpit. So for Maddie, these are too tall. So you can take the crutch and you just push in right here, and then you can slide it up until you get them to the right height, or slide them down if you need to. And then with the hand holds, if they just kind of let their arm drop down, if it hits their wrist, then it's at the right spot. You kind of want it around the hip area. And then with canes, if you're adjusting them or just making sure it's the right height, you want it to hit about to their hip as well and have a slight bend in the elbow when they're walking. When you're positioning or adjusting the crutches, you want to make sure that the crutches aren't right up to their side. You want them kind of up and out about 6 inches from the foot so that you're getting the right measurement. When you're teaching a patient how to correctly walk with crutches, you'll tell them that the affected leg always moves with the crutches. So for example, if Maddie were to walk with it, she would bring the crutches with her injured leg to make sure that she's not putting too much weight or pressure on that leg. And then if they are non-weight bearing, that means that they just keep their leg up the whole time, not putting any weight on it at all. The patient is doing toe touch walking. That just means that they will step with their foot flat on the ground, but they're not putting any weight on it. It's just kind of to help them get back into the sensation of putting their foot on the ground. And then after that, there will be partial weight bearing, and this will be a percentage, and it just kind of depends on what the therapist and doctor says they can do. So that means they're gonna try to walk as normal as they can, going from heel to toe, and just putting that percentage of weight bearing on their leg as they walk. And then the last one is weight bearing as tolerated. A lot of times this is when they'll go to one crutch, and when they have one crutch, you want to make sure that it's under the opposite arm and still moving with the affected leg, and they just walk with as much weight on the affected leg as they can without increasing their pain. If the patient is walking with a cane, you want them to have the cane in their opposite arm from the affected leg, and then they just walk with the cane and the affected leg moving at the same time. When we're teaching our patients how to go up and down stairs with the crutches, we'll tell them up with the good and down with the bad. So that just means if they're going up the stairs, they'll lean on the crutches and go up with their good leg and then bring the crutches and affected leg up. And when they're coming down, they'll bring the crutches and the affected leg down first and then bring their other leg down. Again, with this, the crutches and the bad leg always move together. As tolerated, a lot of times this is when they'll go to one crutch, one crutch, one crutch, one crutch, one crutch.